Urgent kidney warning. 3 vegetables can be real allies for someone with reduced kidney function, and 3 others you should avoid or handle very carefully. If your kidneys are struggling, a plate of healthy greens can work differently for you than for someone with normal kidney function. This video will show you exactly which 3 vegetables to keep in your rotation, why they help, and which 3 to steer clear of because they can raise real biochemical risks. Listen closely. These are practical, evidence-informed guidelines meant to protect you, not scare you. Imagine your kidneys as a fine sieve that keeps the body's balance steady, filtering wastes, keeping electrolytes like potassium and phosphorus under control, and adjusting fluid levels. When that sieve is torn or slowed, when glomerular filtration rate, GFR, falls and creatinine rises, minerals that most people handle without thinking can build up. 2 hidden threats in vegetables are especially important: potassium, which the heart is very sensitive to when it rises too high, and oxalate, a compound that can form sharp calcium oxalate crystals that irritate or damage renal tubules. There are secondary concerns too: sodium, phosphorus, and the way juicing concentrates minerals while stripping away protective fiber. These are not abstract problems. They can translate into swelling, sudden shortness of breath, or dangerous changes in heart rhythm if left unchecked. But there are choices you can make at the grocery store and in the kitchen that reduce risk and keep your meals nourishing. If you or someone you care for has kidney concerns, please subscribe to get more practical kidney nutrition tips and stay updated on safe, evidence-based guidance. First, a quick primer so the why behind each recommendation is clear. Potassium is an essential mineral that helps nerves and muscles work, but the kidneys are the main route the body uses to remove extra potassium. When kidney function drops, potassium can accumulate in the blood, a situation called hyperkalemia, and that can affect the heart's electrical system. Oxalate is a plant-based compound found in some leafy greens and root vegetables. In the gut, oxalate can pair with calcium to form tiny, sharp crystals. In people with low kidney function or a tendency to form crystals, these deposits can aggravate kidney tissue and worsen inflammation. Juicing removes fiber and speeds the absorption of minerals, turning what might have been a gentle dose into a concentrated hit. Keep these mechanisms in mind as we walk through the 3 vegetables to favor and the 3 you should avoid. Let's start with the 3 recommended vegetables, the must-haves that fit well into many kidney-protective meal plans when prepared appropriately. Zucchini, the low-potassium lifeline. Zucchini is unusually low in potassium and sodium compared with many other vegetables. It also contains soluble fiber like pectin, which can bind some toxins in the gut and reduce how much the kidneys have to filter. That's why zucchini is often a safe, filling choice for people trying to manage mineral intake. In the kitchen, keep it simple. Steam zucchini for about 5 to 7 minutes to soften it while retaining its water content and fiber. Avoid deep frying or cooking methods that trap oil and salt. Those defeat the kidney-friendly advantages. A serving of steamed zucchini alongside a lean protein or stirred into a low-salt vegetable medley provides bulk, hydration, and fiber without loading your system with potassium. As always, if your nephrologist has given you individualized targets, follow their advice first. Red bell pepper, a color and nutrient boost with a gentler potassium profile. Red bell pepper brings vitamin C and antioxidants that help protect small blood vessels, including those in the kidney. Compared with tomato-based vegetables, red peppers tend to be lower in potassium, which makes them a smart swap when you want bright flavor without as much mineral load. Eat them raw in small slices, add them to salads, or briefly stir-fry for 2 to 3 minutes so they soften but don't lose nutrients. Pairing a little extra virgin olive oil helps the body absorb fat-soluble compounds in the peppers without adding sodium. Be mindful of pre-made sauces or canned peppers that can contain added salt. For people on strict potassium limits, Always verify with your dietitian or doctor whether red pepper fits your individualized plan. Cabbage, fiber-forward, alkaline-leaning and gut-friendly. Cabbage is a surprisingly valuable vegetable for someone with reduced kidney function. It's high in insoluble and soluble fiber, which supports regular bowel movements and the gut's role in eliminating waste that might otherwise contribute to the kidney's workload. Cabbage also contains compounds like sulforaphane that support gut and vascular health and can contribute alkaline-forming minerals beneficial in the context of metabolic acidosis, a common issue when kidney function declines. Cook cabbage without added salt and keep the cooking time moderate. A gentle steam for 5 to 7 minutes or a brief sauté helps maintain its beneficial compounds without concentrating minerals. Avoid heavy pickling with salt or long braises that reduce volume and concentrate sodium. For people who enjoy leafy greens, swapping spinach for cabbage can reduce oxalate exposure while retaining texture and versatility. Those 3 vegetables are useful because they combine lowish potassium and phosphorus profiles with fiber or protective phytochemicals. But remember, low is relative, and any food should be evaluated against your specific lab results and clinical status. Now let's turn to the 3 vegetables you should avoid or handle with extreme caution. Spinach, a high oxalate green that can form damaging crystals. Spinach is healthy for many people, but it's one of the vegetables highest in oxalate. In patients with reduced kidney function or a history of calcium oxalate crystal formation, eating large amounts of spinach can increase the risk that oxalate will bind to calcium and form microscopic sharp crystals. Imagine tiny glass shards that can irritate the renal tubules. That process can contribute to worsening kidney inflammation or even acute crystal-related injury in susceptible individuals. If you love leafy greens, choose lower oxalate alternatives such as lettuce or the cabbage options we discussed. If a clinician has checked your urinary oxalate or you have a history of oxalate kidney stones, avoid spinach unless a renal specialist explicitly clears it. In short, spinach is not a universal no, but it's a common offender for people at higher risk of oxalate-related problems. Beetroot, nutrient-dense but mineral-dense in ways that matter for kidneys. Beetroot has vitamins and plant nitrates that promote circulation, but it's also rich in potassium and phosphorus and contains high concentrations of other minerals and nitrates that the body handles through the kidneys. For people with impaired kidney function, eating beetroot can produce a relatively rapid rise in serum potassium or add to phosphorus burden. In the context of chronic kidney disease, keeping phosphorus in check matters because excess phosphorus can contribute to vascular calcification and bone mineral problems over time. If your blood tests show elevated potassium or phosphorus, avoid beets and consider alternatives like peeled white root vegetables or small portions of lower mineral greens. Also keep in mind that beets can change urine color, harmless in most people, but potentially alarming if you're monitoring for blood in the urine after a clinical event. Report any unexpected changes to your care team. Celery juice, concentrated minerals without the fiber safety net. Celery on the plate is a different story than celery pushed through a juicer. Juicing removes fiber and concentrates minerals, including natural sodium and potassium, into a small volume. Drinking celery juice can therefore deliver a quick influx of absorbable minerals that may raise potassium levels or promote fluid retention in vulnerable individuals. The fiber that remains in whole celery helps slow absorption and provides bulk that reduces the net mineral impact. If you use celery, chop it into soups or stews where it mixes with broth and other more watery vegetables. Cooking softens the plant and dilutes its minerals across a larger volume. But avoid concentrated celery juice if your kidneys are impaired, especially if you have a history of hyperkalemia, fluid overload, or are unsure about your potassium targets. Think of juicing as taking a high-dose supplement of minerals, a risky choice without medical oversight. For each of the vegetables above, context matters. A single serving of spinach or a small helping of beet in someone with near-normal kidney function might be fine. The issue is cumulative load and individual susceptibility. If your GFR is reduced or your blood potassium or phosphorus has been trending up, those fine choices can become hazardous. That's why preparation and portion control matter so much, and why cooking methods that retain fiber and avoid concentrating minerals are central to the advice I'm giving. Now, a practical kitchen checklist that pulls these ideas together into actions you can take today. Steam zucchini and cabbage for about 5 to 7 minutes rather than deep frying or long, salty braises. Stir-fry red bell pepper briefly, 2 to 3 minutes, to preserve vitamins while keeping potassium relatively low. Avoid juicing vegetables that are mineral-dense, especially celery. If you must use celery in a recipe, chop and cook it in soups or stews to retain fiber and dilute minerals. Don't add salt while cooking. Use herbs, citrus, or small amounts of unsalted flavorings instead. Be cautious with canned or pickled vegetables, which often hide concentrated sodium. There are 3 golden dietary rules that summarize the safest approach for protecting the kidneys while keeping meals satisfying. First, favor low-salt cooking. Salt increases fluid retention and can drive blood pressure up, both of which increase stress on the kidney sieve. Second, prioritize watery, low-potassium vegetables. Think zucchini, cucumber, white radish, and the red bell pepper we discussed. And avoid concentrated preparations like juicing that strip fiber. Third, listen to your body and your labs. Signs such as swelling in the ankles, pronounced sock marks, sudden weight gain from fluid, a metallic taste in the mouth, or unexpected bad breath can be clues that mineral balance is shifting and warrant contacting your clinician. It's also critical to tie food choices to clinical monitoring. Blood tests like creatinine and potassium, plus estimated GFR and urine studies, are the objective measures clinicians use to decide what you can safely eat. These tests change over time and with illness, so a one-size-fits-all diet cannot replace personalized medical guidance. Always discuss major dietary changes with your nephrologist or a renal dietitian who can align your menu with your most recent labs and medications. A few real-world scenarios illustrate why these distinctions matter. A patient with mildly reduced GFR who eats a salad with a moderate portion of zucchini and bell pepper will likely be safer than someone with a similar salad heavy in spinach and topped with a beetroot-based dressing. Another example: a caregiver who gives a concentrated green juice to an older adult with fluid retention may unknowingly deliver a potassium and sodium load that the kidneys cannot clear, leading to worsening swelling and the need for urgent medical review. These aren't scare stories. They are plausible outcomes when concentration and mineral load exceed what the kidneys can handle. I need to reiterate crucial limits and safety points. Nothing I've said is a cure or a guaranteed way to lower creatinine or reverse kidney disease. Food choices can support kidney health and reduce the risk of acute events, but they are part of a wider clinical plan that includes medications, monitoring, and sometimes procedures. Do not stop or change prescribed medications or dialysis schedules based on this information. If you are on potassium-raising drugs, blood pressure medications, or phosphorus binders, discuss any diet adjustments with your prescribing clinician. If you experience symptoms like severe weakness, chest pain, fainting, or sudden breathlessness, signs that could indicate dangerous potassium levels or fluid overload, seek emergency care immediately. Before we close, let me restate the core practical takeaways in one place. Keep zucchini, red bell pepper and cabbage as your go-to vegetable choices when kidney function is impaired, prepared in watery, low-salt ways. Steam zucchini and cabbage for about 5 to 7 minutes. Stir-fry red bell pepper briefly for 2 to 3 minutes, or enjoy it raw in small portions. Avoid or restrict spinach because of its high oxalate content. Avoid beetroot if your potassium or phosphorus is elevated. And avoid celery juice because juicing concentrates minerals and removes protective fiber. Favor whole, fiber-rich preparations and dilute mineral-dense ingredients in soups or stews rather than concentrating them in single servings. This information is educational and general. Individual dietary needs depend on your current labs, medications, and the stage of any kidney disease you may have. Discuss these suggestions with your treating nephrologist or a renal dietitian before making significant changes. They can review your most recent blood and urine tests and create a meal plan tailored to your needs. If this video helped you understand which vegetables can protect your kidneys and which to avoid, share it with a family member or friend who has kidney disease. And subscribe for more practical, evidence-informed kidney nutrition guidance. Take care. Informed food choices can make a real difference, and working with your healthcare team will keep those choices safe and effective.